The number of COVID-19 deaths and infections continue to skyrocket in India. More than 200,000 people in the country have officially died from complications linked to COVID-19. Analysts believe the true death toll is much higher, and it comes after India set a new global record yesterday with more than 362,000 new infections in a single day. Congressman Ro Khanna, a Democrat from California and vice chair of the House Caucus on India, is with us now to talk about what the U.S. is doing to try to help. Congressman, it's good to see you again. Hope you're well.
I am. Thank you for having me on.
So President Biden told reporters yesterday that he discussed sending vaccines to India with the country's prime minister and that his intention to do so, it is his intention to do so. I want to play a bit of what he had to say.
The problem is right now we have to make sure we have other vaccines like Novavax and others coming on probably. And I think we'll be in a position to be able to share vaccines as well as know-how with other countries who are in real need. That's the hope and expectation. And I might add, when we were in a bind at the very beginning, India helped us.
Congressman, as you know, the U.S. has 3 vaccines in use already and a stockpile of millions of doses of the AstraZeneca vaccine, which we can't use here yet in the United States. Why wait?
Well, as you know, the AstraZeneca vaccine was produced in some of the Baltimore facilities, so they have to make sure that it's safe before we ship it. But the president is committed to doing that. And as importantly, right now, the president's committed to sending oxygen, to sending PPE equipment. That is what's urgent. I mean, people there are dying because they don't have oxygen. Hospitals don't have PPE to have allowed doctors and nurses to practice. And Tony Blinken and the president are doing a very good job in mobilizing all of that and getting that to India.
We've done several stories on the situation in India, and I know there's going to be, some segment of the population that's going to say, well, we're not even fully inoculated here in this country. Why look to India? Can you just talk about why it's important to help India out at this crucial time while COVID is spreading? Not just the public health concerns for India and the rest of the globe, but also the role that, in a way, COVID diplomacy works.
Absolutely. Well, first, people should be assured that there's not a single dose that's going to go to India that could have gone to an American. We are going to prioritize Americans in all of the vaccines. These are vaccines, AstraZeneca, that would never be used in the United States. They haven't been approved to be used in the United States. Moreover, what some of us are pushing for is to require Pfizer and Moderna to license their vaccines so other countries like India and 100 nations who don't have sufficient vaccine supplies can start producing it, manufacturing it in their countries. That's important to strengthen our relationship with India and strengthen our relationship around the world. The alternative is that China will license their vaccines, or Russia will license their vaccines. I'd much rather America be seen as helping vaccinate the world, but it will not be in any way at the expense of a single American.
Congressman, you may know that people in India are not only dealing with the horrors of this pandemic, but they're also dealing with a government that is attempting to silence critical voices on social media when it comes to how Prime Minister Narendra Modi has handled this crisis. The government has asked Twitter to remove posts that are critical to Prime Minister Modi, critical to his political party. Have you had any discussions with your counterparts in India, given that you do chair the House Caucus on India, about the freedom of people to criticize if they see something wrong? And there are a lot of people who see some missteps that the Indian government made in fighting this pandemic.
Well, I'm a strong believer in free speech. I believe it's wrong for Twitter or Facebook to take down any of these posts. I made that clear. As you know, I represent Silicon Valley. I don't think they should be censoring posts unless those posts are calling for violence. And we have a call today, the chairs of the caucus, with the ambassador of India, and I plan to make that clear to him as well. I get criticized all the time on social media. That's how democracy is supposed to work, and no one should be suppressing that, censoring that.
Your district in California has a large Indian American population. I can only imagine some of the stories that you're hearing from your constituents and just how concerned they must be about their loved ones and their family members still in India. What have you been hearing?
I appreciate it. It's a really terrible situation. There's not a family, Indian American family in my district who I've talked to who doesn't know someone, a relative, a friend in India who's being affected. And it's not just the horror stories of people being cremated on sidewalks and people not being able to get hospital beds. It's also daily life that is impacting everyone. They don't have Amazon delivery in the same way they don't have DoorDash. So people still have to go out to go get essential groceries, to go get essential medicines. And when they're going out, they're at risk. And many people have developed, unfortunately, gotten COVID. Some are recovering. Others, where it gets serious, are really concerned that the medical system simply won't be able to care for them. Most people who have talked to people in India say it is the greatest humanitarian crisis they've seen in India in their lifetime.
It's such an important point that you raised there, Congressman. I'm glad Anne-Marie asked you about it, because I cannot imagine what it would be like as we start to see light at the end of the tunnel here in this country as more and more people get vaccinated. And of course, the president's going to talk about that later today, how helpless one must feel when they know that they have family members in another country that are either suffering because of COVID-19 or, you've heard reports of people that are sort of locked down in their apartments feeling as if they know they're going to get it, even though they're trying to do everything right. I've seen photos and videos of people waiting in line to refill like their own oxygen tanks because the government doesn't have enough oxygen for people. I mean, what can people do if they are here in the United States, short of traveling or trying to get somebody there, which is impossible?
Well, I appreciate you raising that, and I appreciate your recognizing the privilege many of us have. I mean, it was an issue in our country where a lot of people who weren't on the front lines were able to quarantine, and others had to still go outside and be exposed. And in most other parts of the world, you don't get to work remotely. You don't get to get all your supplies and essentials remotely or delivered to you. And so there's high level of exposure, and people are basically going out knowing that they face a significant risk of being exposed. What everyone can do, I think, is one, to help support getting PPE, oxygen to India, and there are some organizations, reputed organizations, that are doing that, and then to support President Biden and the administration in the effort to do that. Long term, I do think it's so important for the world that Pfizer and Moderna license their vaccines so other countries can develop that vaccine. And it's important for the United States because when you have these outbreaks, and if you look at it, the variants that are developing, all it takes is one of those variants to break through our vaccine. And then we're going to be in a very difficult situation here where we're going to need boosters, where we're going to need to revaccinate everyone, and we put Americans at risk. And that's why we can't allow for these outbreaks to continue.
So while we have you here, we have to ask you about the President Biden's address to a joint session of Congress tonight. A couple of questions. Are you going to be in attendance virtually, or will you actually be in the room? And, Americans are going to hear about the American Families Plan for the first time. There are a lot of really interesting elements, but it also comes with a pretty hefty price tag. So what are you and your colleagues in the House, talking about and looking forward to?
Well, I'll be virtually. There are a very small number who will actually be in the chamber. The speaker has appropriately been very cautious, not wanting to take any risks with a large gathering. But I'm really excited about the president's proposal and the vision he's going to lay out, making sure every American has the opportunity to be in preschool, making sure that everyone can go to at least 2 years of community college, making sure that people have child care and can afford childcare, and then the traditional infrastructure, our roads, our bridges, our airports, our internet in a remote world to make sure people have access to affordable internet. These are things that have been neglected for decades in this country, and it's wonderful to see President Biden doing that. You're right, it will cost money, and he is saying that those who have done very, very well can pay a bit more. I mean, some of them are not paying taxes. $1 trillion can be collected just for people who aren't paying taxes. and then some people aren't paying capital gains on appreciation. They're holding it till they die, passing it on to their heirs. That should be taxed. So there are some common sense proposals on how to raise the revenue.
So let's talk about that. Part of the president's plan includes raising taxes on top earners, increasing the capital gains tax on people making more than $1 million a year. You yourself have introduced a bill called the Stop Cheaters Act, which would also affect wealthy Americans. Tell us what's in this bill and where it stands right now.
Well, here is the staggering statistic. There is $1.2 trillion that is not collected because people simply aren't paying the tax they owe. The top 1%, they often get business income, and that isn't disclosed to the IRS. So most of us, you pay tax, you get a salary, it comes out of your W-2 form. But many people who make business income don't disclose all the business income they make. They tend to be the 1%. What we're saying is banks should disclose that. There should be auditing of those individuals. And then you would raise $1.2 trillion. That would get about a third of the way of paying for the president's infrastructure.
All right, Congressman Ro Khanna, always great to have you. And I think, Congressman, going back to our earlier discussion about what's happening in India right now, you know, it used to be, and I understand that we ourselves, and just like the rest of the world, is dealing with COVID-19 and the pandemic. But, you know, when I was growing up, I mean, I remember Live Aid, for example, which was the concert to help people who were suffering in East Africa. We can't do live concerts, but we can organize. You mentioned PPEs. I mean, there's got to be a vehicle with perhaps the federal government leading that effort to allow those of us who are privileged, those of us who have been able to get vaccinated and are starting to be able to live our lives a bit more normally, to be able to help people who are suffering. You pointed out India is a democracy. It's the world's largest democracy. You know, we should be able to help people who are not as privileged as we are. So I hope that something is made clear for the American people in the days and weeks ahead.
I appreciate you saying that, and I think that's true to who we are as Americans. We've always believed in the human rights and dignity of everyone, and I think deep down we're a very charitable nation, a philanthropic nation, and this is the time that people in another part of the world need our help, and I'm confident people will rise to that.
Congressman Ro Khanna, it's always great to have you, sir. Thank you very much.
Thank you. Appreciate it.